Yes, of course, because we have the freedom to do almost whatever we want, logistically and on methods and operational aspect. If we need a computer because one is broken, we cross the street, we buy one, and we have it immediately. We don't have to fill form in 10 duplicates and wait for 6 months. But that's and in order to adapt the way the work we do, same thing. We can be much more action-oriented and rapidly oriented towards action. So that's a tremendous freedom. The price to pay that we have is that we have to generate the income so that EpiConcept is functioning. So every month we have to have contracts so that we pay the people. And I would say that probably 85-90% of the contract generated by EpiConcept are response to call for tenders from the public sector, and in epidemiology and in the information technology computer department. That's the same. We mainly respond to public tender and mainly to public health standards. So a lot of what we do is public health. So in a sense, we do job, we carry out activities, research project, training activities, development of software for the public sector, which is nice. We can work with the environment we like, which is the public health, and also have the freedom to work as we want because we are a private organization. Yeah. A small part of what we do is contract with the private sector. Since we are involved quite a lot in vaccinology, we do quite a lot of vaccine effectiveness study, which is measuring the efficacy of a vaccine once it is on the market. And we have really one condition for whatever is paying for the work, whether it is public money or private money. We want to be totally independent in the way we write the protocol, in the way we do the study and the analysis, and in the way we publish. I mean, I have an example. After the pandemic, during the pandemic, we had established a system in which several private groups put money in a common pot to finance independent studies. And this worked during the pandemic. None of the study site knew who was financing, and vice versa. We tried to do it again the following year for a big budget and 5 study sites in Europe. But one of the private company placed a sort of veto by saying, we want to have the right to review the analysis and the publication. So in 2 minutes over the phone, we have lost 1.2 million euros because we refused. So it was a common decision with the study site, but we said, sorry, we cannot accept to work under such condition, so we stopped immediately everything. So that's this, and we had other things like that happened. Yes, from time to time, we do not sign a contract because we disagree with the way the sponsor, the founder, is requesting to have a view on the message that will come out from the research. So independence is really a must. And so far, I think we have never deviated from that.